At the Center for Health Transformation, we have a series of proposed reforms. They start with health-based health reform, which would mean migrating the system to a value-based payment system. In fact, the head of the Mayo Clinic has an article about this morning. And there's no question that if you look at the best outcomes in the country, if you look at, for example, the Gunderson Lutheran Hospital System in La Crosse, Wisconsin, which is the least expensive last 2 years of life in America, which has a great system of virtually everybody gets an advanced directive, virtually everyone. All of those are kept on an electronic health record, so all the staff knows what the advanced directives say. They have a very powerful palliative care system and a very powerful system of hospice care. The result is they cost around $18,600 in the last survey, compared to over $58,000 for UCLA. And they have, this is for the last 2 years of life, and they have a much higher satisfaction rate from the families than UCLA does. So you have to ask yourself, why would you pay 4 times as much? I mean, we pay $40,000 more, actually paying about 3 times as much. Second, we have a brand new book that just came out from Jim Froug, who actually used to be here at Heritage. Froug is now at the Center for Health Transformation. And the book is called Stop Paying the Crooks. And it has 13 contributors on fraud and theft in Medicare and Medicaid. The estimate is that between $70 and $120 billion a year in Medicare and Medicaid money is fraud. 5 pizza parlors in South Florida, for example, that had been accepted by the U.S. government as HIV/AIDS transfusion centers, and the government was sending them payments for HIV/AIDS transfusion centers, and they were a pizza parlor. So the second point I would make is that if you could save between 50 and 120 billion a year, the New York Times estimates that New York State Medicaid is over 10% pure fraud. That's over $4.4 billion a year. Why would you raise taxes on honest people before you stop paying the crooks? Third, we have a program that Wayne Oliver heads up on malpractice reform. If you look at places like Texas that have had successful malpractice reform, they have less defensive medicine. They have lower payment for their insurance. They have more doctors because people are willing to practice without being afraid. And so you'd have to say that any serious health reform would include malpractice reform. Fourth, we have a project on community-based health with things like diabetes in Columbus, Georgia, that Laura Lynn heads up. We believe diabetes is the largest single cost driver in Medicare. It's every 4th dollar of Medicare is related directly or indirectly to diabetes. We think you can have a much better outcome, early detection, self-management, prevention, wellness, and then if you do end up being diabetic, being trained in how to manage yourself. Dramatically lower costs, dramatically better health outcomes. And lastly, we have an Alzheimer's study group headed up by Michelle Stein. And as recently as this morning, I talked to a world-class scientist who agrees Alzheimer's is a $20 trillion projected cost to the federal government, very large projected cost for state government, very large projected cost for individuals between now and 2050. When we organized the Alzheimer's Study Group, which Justice Sandra Day O'Connor served on, and Senator Bob Kerrey, a Democrat of Nebraska, and I co-chaired, we had 3 Nobel Prize winners and 125 other neuroscientists who said that if we had the right investment level in brain science, organized the way the Human Genome Project was organized, that is oriented towards rapid breakthroughs, they thought we could get to a fundamental breakthrough between 2020 and 2025. That would save the federal government between $9 and $12 trillion. Now, the things I just outlined all save collectively enough money that within a decade you could afford 100% insurance coverage with no new tax increases, no big government program, and without having to ration care. And that would be a solution-oriented model as opposed to the deliberate power grab that raises taxes, kills jobs, and centralizes decisions in Washington, which is what's in the House right now.